Welcome to the Kentucky Employee Health Plan orientation for new IC, HRGs, and billing liaisons. This training will consist of 3 modules. Module 1 that you're currently viewing is the Administration Overview, TPAs, and Contact Information, the IC, HRG responsibilities, eligibility for the Kentucky Employee Health Plan, enrollment, qualifying events, transfers, leaves, and termination. Module 2 will be benefit highlights and benefit options. Module 3 will be TPAs, wellness and transparency, and online tools. The Kentucky Employee Health Plan has been self-funded since 2006, covering over 266,000 lives. The Kentucky Employee Health Plan has school boards, early retirees, state agencies, and quasi-agencies. Mostly Kentucky residents. However, retired members living outside of Kentucky will also have coverage in the 50 states. As you will note, school boards make up 50% of the Kentucky Employee Health Plan. The Kentucky Employee Health Plan oversees the administration of the Kentucky Employee Health Plan, The Department of Employees Insurance oversees the administration of the Kentucky Employee Health Plan. Anthem is the TPA for the medical. CVS Caremark is the pharmacy benefits administrator. WageWorks handles the FSA, HRA, COBRA, and HIPAA. Humana Vitality is the wellness vendor, and Smart Shopper Compass is the transparency vendor. The DEI Contact Information for the Kentucky Employee Health Plan. You will note that it consists of 5 branches. Member Services Branch is catered to the members with any questions or concerns regarding cards, eligibility, and claims. The Department of Financial Services will answer any questions pertaining to billing. The State Wellness Specialist can answer questions regarding wellness. And the Enrollment Information Branch is catered to the ICs and HRGs for questions pertaining to processing, qualifying events, and then lastly, the Data Analysis Branch, which is the branch that generates all of the reports for the Kentucky Employee Health Plan. Please note, when you contact a member of one of these branches, to please dial the numbers that's listed on your screen and don't pick a favorite person. Staff members are dedicated to these lines each day at certain times and therefore can be reached when you contact these numbers. You can also email if you need to get a response quickly. IC, HRG, and billing liaison responsibilities. You as an IC, HRG, or billing liaison represents an agency that participates in the Kentucky Employee Health Plan and the Kentucky Group Life Insurance. As a representative of an agency that participates, you will need to do the following. You will be responsible for training. The training will include the Kentucky Employee Health Plan orientation, which you are viewing currently. You will have CRIS training and HIPAA training, which is required for system access. Coordinators and HRGs are responsible for processing in CRIS. Employee enrollments, if the employee are not able to enroll themselves in CRIS, can be processed by coordinators or HRGs. The preferred method is for employees to complete their own enrollment in the CRIS system. If you, as an insurance coordinator or HRG, enroll a member in the Kentucky Employee Health Plan in the CRIS system, you need to keep that application in a personnel file. Do not send to the Enrollment Information Branch. Your responsibilities will include terminations, leave without pays, birth date corrections on employees excluding the dependents, employee name changes, and address changes. Members of the Kentucky Employee Health Plan may have the option of making these changes themselves in the CRIS system. Also, you as an IC and HRG will need to provide any and all information from the Department of Employee Insurance and the Kentucky Group Life Insurance to your employees. This will include any update forms for the employee. Transfers, military leave beginning and ending, leave without pay beginning and ending, and reinstatements with a break in coverage. There are certain applications that cannot be processed by members or by ICs and HRGs. These applications must be submitted to the Enrollment Information Branch for processing, along with any supporting documentation that is required. These applications would be the cross-reference payment option applications, dependents who transition to a new employee, retirees returning to work, and qualifying events. As an insurance coordinator and HR generalist, your responsibility includes counseling your employees. You should be able to answer any health insurance questions, qualifying event questions, and be able to provide the members with details or contact information where they can receive assistance. The administration manual is listed on the Kentucky Employees Health Plan, and all coordinators should refer to this when there's any questions on the Kentucky Employee Health Plan itself. COBRA is a federal law that requires all employers to provide continuation of medical coverage at group rates in certain instances where there is a loss of group coverage. COBRA will be administered by WageWorks. However, timely entry into MUNIS for the boards of education or the CRIS system is important in order for these notices to be generated by WageWorks for members that are needing the continuation of coverage. Those would include your new hires, your terminations, and qualifying events, which need to be submitted to the enrollment branch. Some ICs or HRGs may also manage the monthly bills. However, most agencies have a billing liaison, which manages the monthly bills. The responsibility for the billing liaison would be to reconcile, process, and release the life and health insurance premiums, administration fees, flexible benefits, health reimbursements with the biller direct. The Kentucky Employee Health Plan houses all of our information on our website. You will need to provide your employees with the website kehp.ky.gov. There is training available to coordinators on the website, and there was also a checklist that coordinators can utilize for any new employees to make sure that they've covered all areas of coverage with the member. Members and coordinators can access the summary plan description and find all information pertaining to the Kentucky Employee Health Plan online. The Kentucky Group Life Insurance information is located on the website listed on your screen. And also, remember to always provide the notice about the Women's Health and Cancer Rights Act, which is listed in the Administration Manual Appendix B. Eligibility for the Kentucky Employee Health Plan can be found in Chapter 1 of the Administration Manual. Who is eligible? All full-time employees or employees who work full-time hours are eligible for coverage in the Kentucky Employee Health Plan, or those who contribute to a state-sponsored retirement system or otherwise defined in KRS 18A 225. These members would consist of state agencies, boards of education, health departments, quasi-agencies, and school board members. They may participate on a post-tax basis. However, they are responsible for the total premium. KRS and KTRS retirees who return to work. These retirees must be offered a Kentucky Employee Health Plan or waiver HRA. These employees need to contact their retirement system to determine whether they will be eligible for a plan through either retirement or whether they should roll in the Kentucky Employee Health Plan. The health insurance application must be completed with the active agency to avoid a default election. If your Kentucky Employee Health Plan retiree elects coverage through the retirement system, they will still need to complete a health insurance application to waive coverage to avoid being defaulted to a plan. Members that are retired that return to work may elect a flexible spending account with your agency if you participate in the flexible spending account program, and they must complete the application with their active employer. Other individuals that are eligible for the Kentucky Employee Health Plan would be legally married spouses or retirees, employee or retiree's children under the age of 26, which would be single or married, and it can include member's child, stepchild, adopted child, foster children, grandchildren who meet the dependent eligibility criteria. Please note that a common law spouse may be eligible for coverage if the marriage took place in a state that recognizes common law marriage. Kentucky is not a common law marriage state. Any members wanting to elect coverage for a common law spouse must provide documentation as proof of where that marriage took place in order to have that spouse enrolled. Disabled dependent children are covered under the Kentucky Employee Health Plan. They may continue to be covered beyond the limiting age if the disability started before the limiting age and the disability is medically certified by a physician. Anthem will determine the eligibility for disabled dependents, and all information will be submitted to Anthem for review. If a disabled dependent is not covered prior to the limiting age, they will only be allowed to enroll if the dependent experiences the loss of other coverage, and they must meet all other eligibility requirements. Jeff Wiley is the contact to request the certification form for disabled dependents. He can be reached at 502-564-1205 or jeffrey.wiley@ky.gov. There are other considerations for coverage in the Kentucky Employee Health Plan. Foster children must have been placed by an authorized agency or court order, and a grandchild can only be added with a court order. Superintendents with working spouses, active employees and dependent spouses age 65 or older, deceased or Medicare eligible retiree beneficiaries, and spouses of retirees. All of these may require supporting documentation, and they're subject to signature date guidelines. Refer to the administration manual for specifics. Enrollment, Chapter 2 of the Administration Manual. Employees of the Kentucky Employee Health Plan have 35 calendar days from their date of hire to make health insurance elections, either online through the CRIS Employee Self-Service System or by completing an enrollment application electing one of the following. Members can enroll in a health plan or enroll in a waiver HRA or dental vision only HRA if their agency participates in the HRA FSA program. They can choose to waive coverage with no HRA and or enroll in a healthcare and or dependent care FSA. Coverage for employees is always effective the first day of the second month following the date of hire. An example, if an employee is hired May the 1st, their coverage with health insurance will become effective July the 1st. The CRIS system will count exactly 35 days from the beginning of the day after the hire date. Employees may enroll online in the CRIS employee self-service system, or they can complete the application and provide it to you as the insurance coordinator. The employee self-service is the preferred method for employees to ensure that they're getting the coverage that they are requesting. Again, you as an IC or HR generalist may enroll the employee online, provided that that employee has completed the application and signed it within 35 days. It's important to note that if you enroll an employee online, you must enroll them under your credentials. If you enroll them online with an application that they provided, you will need to keep that application in a personnel file and do not submit it to the Enrollment Information Branch unless you as the coordinator or the member could not enroll themselves online. ID cards will be mailed to members at their home address, generally 10 to 14 days after the enrollment is processed in the CRIS system. Insurance coordinators should not turn away any paper application that is provided to them by a member. Some employees just aren't eligible to enroll online and must submit a paper application, or they may experience technical difficulty and require your assistance. Members that must submit a paper application would be the cross-references, employees that are dependents on another Kentucky Employee Health Plan, and retirees that return to work. In order to trigger the CRIS user ID to the new employee, the IC or HR generalist must complete the employee shell in the PA 40. The employee is automatically enrolled into a default standard consumer-driven health plan, single level of coverage, until either they've enrolled online or you have processed an application on their behalf. If an application is not entered to the CRIS system within 14 calendar days of the plan's effective date, the default plan ID card will be triggered to the member. Employees who do not meet the enrollment deadline will be defaulted to the standard CDHP at a single level. CRIS will automatically default the member to a standard CDHP plan unless action is taken within the time frame to enroll for coverage. Members who are defaulted to the standard CDHP plan will not be able to enroll in coverage until the next open enrollment period unless they experience a qualifying event. The member may file a grievance. Qualifying events can be found in Chapter 5 of the Administration Manual. Qualifying events are considered life-changing events which will allow members to make mid-year election changes to their health insurance plan. These events can include marriage, birth, adoption, loss of coverage, gaining coverage, ineligible dependents, court orders, Medicare, Medicaid, among others. To find a list of all the qualifying events, please refer to the Administration Manual. Note that the effective date for birth and adoption coverage will become effective the date of birth or adoption. Qualifying events are complex and often have more than one event taking place at the same time. It is crucial for you as the coordinator to identify the correct qualifying event to meet the desired level of coverage or plan that the member is seeking. An example is marriage. Marriage is not a qualifying event to drop coverage for a spouse. However, the event of marriage is used as a qualifying event for gaining other health insurance through the new spouse's employer. Another example would be divorce. Divorce is not a qualifying event to change from the health reimbursement account and elect coverage. The qualifying event to elect coverage would be loss of other coverage. Qualifying events that are incorrectly submitted cause documentation issues and will result in delaying in the processing. Please refer to the qualifying event worksheets to ensure that all the information is submitted based on the qualifying event that is actually taking place. Most qualifying events with the Kentucky Employee Health Plan has a 35-day window for members to sign the application to submit to you as the IC or HRG. We do have some qualifying events that are considered a HIPAA special enrollment right, which will allow a 60-day time frame for members to complete the application for changes. The HIPAA special enrollment right qualifying events can be found in the Administration Manual, Chapter 5. Qualifying events can allow pre-signing to the event taking place if the members experience a loss of other coverage, gain other coverage, entitlement to Medicare, or experience a different open enrollment period. The changes are typically effective the first of the month or term at the end of the month. It is important to note that no qualifying event will become effective prior to the event taking place. Qualifying events cannot be processed in the CRIS system by the member or the insurance coordinator. All qualifying events have to be submitted to the Enrollment Information Branch with the supporting documentation for approval and processing. If the documentation is not received, the qualifying event will be pended and the insurance coordinator, HR generalist, will be notified. Any qualifying event that is pended beyond 35 days will be rejected and the insurance coordinator and HR generalist will be notified. Again, remember, the qualifying event date is the date the event takes place, not the date an employee is notified of the event taking place. However, there's a couple of exceptions to this rule. Notification date is only accepted for entitlement to CHAMP VA, TRICARE, and entitlement to government programs such as Medicare and Medicaid. All information pertaining to qualifying events can be found online at www.kehp.ky.gov. You will find this information under ICHRG Resources in the Administration Manual. Transfers, leave, and terminations can be found in Chapter 2, 4, and 6 of the Administration Manual. The Kentucky Employee Health Plan has 3 different types of transfers. A transfer takes place when an employee terms from one Kentucky Employee Health Plan agency and begins employment with another Kentucky Employee Health Plan agency. The effective date of coverage will depend on the type of transfer that member has experienced. A clean transfer equals 0-day break in health insurance coverage. These transfers are basically an employee that leaves an agency one day and starts with an agency the following day. A small break transfer is a transfer of employment between 1 and 10 working days. The small break transfer could result in a half-month break in coverage. This will be determined if the break occurs within the same billing period. It would be no break in coverage, but if the break occurs in a different billing period, half-month break in coverage will be experienced. Members that have 11-day or greater break in employment will be treated as a new employee. Their coverage will become effective the first day of the second month, and they must submit a new application to elect coverage. They will be allowed to make changes as they desire. Leave without pays. Starting leave without pay, Our employees employees are approved for leave without pay can be on intermittent leave without pay. They can still be eligible for the employer contribution if one of the following occurs. If the employee works or is paid at least one day during each applicable semi-monthly period, or if the employee doesn't receive sufficient pay to cover his or her portion of the premium, they must submit a personal check for the amount due to the insurance coordinator or HRG by the 20th day of the coverage month. Any healthcare FSA, dependent care FSA, or HRA will terminate at the end of the semi-monthly period of the last day worked. It's critical for you as an IC or HRG to submit update forms for leave without pay beginning and ending as soon as possible to the Enrollment Information Branch timely. This will prevent members from experiencing arrearages. Military leave. Employees called to active military leave are eligible for benefits through TRICARE. The employee's dependents may also be eligible for benefits through TRICARE. However, employees that begin military leave may choose the option to remain covered by the Kentucky Employee Health Plan. They could either stop their health insurance coverage on the last day of the semi-monthly billing period in which they are activated with the armed services, or they can choose to maintain their current level of coverage in the Kentucky Employee Health Plan, provided that the premiums are paid by the specified dates listed in the administration manual. It's important to note that employees who elect to maintain their health insurance coverage, that they would be responsible for not only the employee premium, but also the employer cost. Employees returning from military leave will have benefits reinstated upon their term date without any waiting period. Military employees have the option to delay the reinstatement of their prior elections until military coverage ends. If they choose to do this, these employees may waive coverage and enroll in a waiver. However, it would have to be a dental and vision only HRA until the TRICARE coverage ends. Employees choosing to remain covered under the Kentucky Employee Health Plan while on military leave must present a new application with supporting documentation in order to be covered under the Kentucky Employee Health Plan once TRICARE has ended. Health insurance termination will be dependent upon the date that employment terminates. Employees that terminate employment between the 1st and the 15th of the month, their coverage will terminate the 15th of the month. An employee that terminates employment between the 16th and the last day of the month, their coverage will terminate the last day of the month. It's important for the Commonwealth paid IC HRG to complete the PA action to terminate employment, which will automatically terminate the benefits. The non-Commonwealth paid ICHRG need to manually terminate the benefits. For terminations for Board of Education summer transfer employees, school district employees who work under a July 1st through June 30th contract will be allowed to retain coverage through August the 31st, provided that they fulfilled the terms of their contract and that the employee premiums for the summer coverage was deducted from their paycheck. Some coverage extension rules apply. The same coverage extension rules will apply to the pink slip employees. This concludes Module 1 for the new ICHRG Kentucky Employee Health Plan orientation.